Well, thank you very much for the introduction, and also thanks for the invite to come and talk to you all for a bit this afternoon. I think that my role's been well described, so I'll move on to what I would like to talk to you about this afternoon. Is it coming out okay on the slides? Oh dear, I've lost half my words, with apologies. I'll tell you what it should be saying on there. So we're going to talk a little bit about the science of exercise and why we think movement matters for people living with scleroderma. And then we're going to think about how you might apply that. And if you're willing, if your lunch has gone down sufficiently, we might get you doing some exercises together, if that's okay. So I'm joining you from Greater Manchester. As was said, I work at Salford Royal Hospital. There's a modern picture of the building there. There's a slightly less modern picture of the team, and you might recognise one or two people from our team picture. I think that might be mid-2000s there. I just wanted to point out, because we do see people travelling from quite a distance, it becomes pertinent that we teach people how to become their own physiotherapist, really, living with these conditions. And therefore, we've had to think quite a bit about the resources we give you and the explanations we give you as to how we think you should and could become your own physiotherapist. And I'll be giving you a little bit of that as well this afternoon. We're also going to go on a world tour. I'll have various flags through my slides to indicate which country we are in. But for the first one, we're covering the whole world. So this is the Global Fellowship on Rehabilitation and Exercise in Systemic Sclerosis, which is called G-Force. Show of hands, anybody heard of G-Force? As of yet? Oh, there's one hand over there, very good. So this is a few years ago. People got together and said, we really need to be thinking about how we improve people's outcomes living with scleroderma by means of exercise treatment as a global group. And the paper was postulated as saying, we've got some brilliant tablets, injections, infusions, other things that might improve your outcomes, but actually we should consider exercise also as a disease-modifying medicine, something you can take or do daily that should improve your outcomes. With apologies, the next slide is not a test of your eyesight. I'm not expecting you to read every component, but this came from the G-Force group thinking about how could we help different manifestations of scleroderma through exercise. So as I say, please don't read all of that. You can go and get the paper at your leisure if you'd like to. I put it on screen just to indicate what we think exercise can help with, and that's a long list of scleroderma manifestations or symptoms. It won't cure them, but we think exercise could help as a regular habit for a lot of those components. I'll highlight a few for those who are wanting to see. So there's inflammation in there as one of the main causes of your issues, but also it can help with your sleep quality, your fatigue presentation, perhaps with your bowel working as best as it could, maybe with your skin tightness. It could help with your pain levels, with your facial changes possibly. It could help with your respiratory, and I think that might have been reflected in the previous talk as well. However, one size does not fit all. So we can give you a perfect exercise regime, but if it doesn't quite suit your day-to-day routine, your preferences, etc., it's probably not going to land. And this is well evidenced by a survey that they did in the Netherlands a couple of years ago. And they asked people living with scleroderma, what were they doing as a regular exercise habit? And I think this group must have been super honest, because we didn't get 100% I do everything from anyone. And in fact, if we look at the forms of exercise, the highest scoring, about 72, 73% of respondents said, oh, I do my muscle strengthening exercises twice a week. And that is the guidance, really. About 50, 60% were doing some stretching exercises, similar numbers doing some aerobic exercises, getting your heart and lung working as best they can. But then lower numbers when we think about balance exercises, perhaps mouth exercises if that is an issue for you, but also relaxation and even hydrotherapy made it onto there. So the conclusion from this Dutch study group was that there's a significant variation in what people are managing to fit into their day-to-day routine, but also a potential underuse of physiotherapy techniques to improve your outcomes. So we're going to look at the research to date to give you the science behind why we think you should be doing some of these activities. And it breaks down into 4 main groups, what's been done thus far with research. So one of them is what we can do to improve your hand function. Another is for your general cardiovascular fitness. Another is for the face and mouth. And the final is some work that was undertaken in Italy looking at hands-on manual therapy and massage. There's a reason why I found it irresistible when I was invited to join you this afternoon, and that's because I did have some research funded by SR UK a number of years ago. And again, I'm not expecting you to read the whole of this slide. These are the 12 studies that are scientifically solid to build our evidence on for exercise in systemic sclerosis. And if you look very closely at the top of the list is my name. I should say it's Gregory et al, and one of those et als is sat on the table just in front of me. So I have to credit Professor Herrick for being a massive support as I did this research that I will tell you a bit more about in a moment. So why do we worry about the hands? Well, we know that hand function is a significant issue for many people living with systemic sclerosis. And we also know that there are potentially ways to improve it. And again, this is slightly awkward when you quote from somebody in the room, but this is Professor Herrick's work, and it looks at 3 different trajectories for skin tightness. With the bottom of the graph being newly diagnosed, we then go over to 4 years post-diagnosis. And this correlates with my experience of working with people to try and get that movement back. If we look at the orange line, this person has increasing restrictions in movement, and we don't get much of an improvement over time. However, the blue and the green line, we do see it around 2 years, things start to loosen a bit, and we can get some of those crucial movements back. So it is rather unfair living with scleroderma in that the person who does all of the exercises for the hand, as and when we ask, if they're in the orange group, it won't necessarily improve the movements, but it will stop it getting worse. If they're in the blue or green group, then we would see improvements or expect to see improvements at that 2-3 year post-treatment stage. So what are we asking you to do to keep your hands mobile? We're going over to Sweden for the first bit of significant research in this area, and this is Gunnar Sankvist's work, who said that the exercises need to be adapted to each individual's needs. So in other words, we can give you 6 exercises that we think are good for getting your hands moving better, but you also need to think about what works particularly for you, what your particular restrictions are. And the punchline of this research to take away is the movement did improve, the grip did improve, but the pain levels didn't improve. So we may not improve the pain you have, but we can get you using your hand more effectively. So it's a bit of a half sell I'm giving you there, but perhaps getting that movement and strength back is the bit that will make life much easier. I move on to the SR UK funded research where by people like yourselves we were suggested we could look at the wax baths that are available and see what heated treatment to the wrists and hands might offer in addition to the exercises. It is a research study where we accepted the negative results or the null hypothesis. So we found that both groups doing the hand exercises improved their movements, but the 16 people living with scleroderma who had the wax bath to use at home didn't improve more than the 16 people who didn't have the wax bath. So it doesn't mean the wax bath isn't effective, but it does mean it's not quite at a level where the NHS might prescribe it for you and provide it for everyone living with the condition, which was one of the aims we were looking at. It does reassure us, though, that the hand exercises are effective. The sharper view will have noticed there's another study on this slide, and coming from Denmark, I was stood at the World Scleroderma Congress a few years ago presenting our research, and stood next to me was this very pleasant Danish chap who'd done the same research and had the same conclusions. They used warm water rather than wax, but again, they found the water or the paraffin didn't give huge additional benefits. If it helps with the pain, I can highly recommend it, but it's not essential for everyone to have that kind of a routine in addition to the hand exercises to see their movements improve. So what might you do for your stretches? And the best looking program from the research to date is from over in Japan, and this is the protocol we copied for our SR UK funded study, and we asked our very kind participants to undertake these exercises once or twice a day, which they did. 3 simple exercises. They are available on the SR UK website, and I'll profile them at the end of this talk if we get time. If not, you can go onto the website and have a look at the video at your leisure. The crucial bit being that arrows on these images demonstrate the fact that we think auto-assisted exercises are better. So you take your finger to the end of the movement and then you use your other hand to push it that bit further. This is dependent on the quality of your hand. If you're struggling with ulcers that make it uncomfortable, please don't over-push, but a little push at the end of the movement seems to be better at improving the particular skin tightness that we see in scleroderma. If that's the hands, we'll move on to the face. And we know that for many people, the limitations of mouth opening can be quite restrictive. Again, we're going round the world here, but from the Canadian research, speaking to people living with systemic sclerosis, there was a clear indication that quality of life was limited when mouth opening was limited. It impacts on mood. It also impacts on how easily you can speak and converse with other people, perhaps on how easily you can eat. And also when you go to the dentist, it can be challenging. So what can we do for helping with your mouth movement? Well, this is rather old research. We're going back to 1984 here, before the majority of you in the room were born, looking at your youthful complexions. But 1984 was the first time that there was a thought of adding in an auto-assisted component to the mouth exercises. So instead of the exercise I'm going to ask you to do in a moment, there was an additional element of pulling the skin around the face to improve that quality of movement and function from there. That was 1984. It was repeated 20 years ago in Italy, and again more recently again in the USA, both showing the same level of benefit of this facial stretch routine. What was quite interesting around that time, just at the turn of the decade a few years ago, was is there a way to improve this using additional machinery? And I'll show you a picture of a machine with somebody using it to do this stretch, and sadly have to tell you it didn't have significant benefit. So it's another routine where we've thought about adding in extra equipment to improve it, but it seems the exercises themselves are sufficient. So this is the Therabite. I'm not quite sure why it's in black and white, but there we go, where the machine forces the mouth open and makes you able to stay in that stretch position for a bit longer. Not sufficient evidence to recommend that just yet. So we'll move on to the next component here, which is the idea of manual therapy or massage. And there was a huge amount of research that came out of the Italian centre just at the end of the 2000s. They had a big funding grant and looked at all manner of different treatments. And there was benefit of this manual therapy and massage type intervention. However, it was based on 18-hour-long sessions of treatment. Now, we've had mention of NHS Scotland versus NHS England. I'm not sure either service is offering you 18 hours of treatment to access this kind of thing. And again, it was found the exercises by themselves were as good as the manual therapy. So please do be your own physiotherapist, be your own masseuse. You can get improvements from that. The final area to look at is your cardiovascular fitness exercise, and this is an area there's a lot of interest in at the moment and more research coming through. Apologies, another busy slide, but we're going round the world with research from the UK, Sweden, Italy again, and in Brazil, where they found different forms of exercise can get you fitter. There's some nice research there as well where they looked at people living with pulmonary artery hypertension, and as long as you were sensible with finding the right level of exercise on the treadmill or on the arm ergometer, we could still improve general fitness through these kind of techniques. So those are the 4 areas where we've got the best science. It doesn't mean there aren't other exercises that might benefit you, but this is where the science has sat so far. So if that was the science bit, we'll now think about how you might make it happen in your day-to-day routine. Going back to the G-Force initiative, we do know that physical inactivity does contribute significantly to the overall burden of living with systemic sclerosis. We also know that the earlier your healthcare practitioner or your doctor or rheumatologist or whoever you see says, perhaps you should think about your general fitness as well, the earlier they say that, the better you're going to potentially do that. And the more ritualized you can get with your exercise, the better outcomes you have. You perhaps all spend 2 or 3 minutes twice a day cleaning your teeth. And if that's a 5-minute a day routine, then is there 5 minutes you might find for stretching that tight area or thinking about your cardiovascular fitness? So what might you do as your self routine? And I'm profiling a booklet that I think is just awaiting redrafting from SI UK with regards to our physiotherapy specific advice. With the first thing, choose an exercise that you enjoy, that you will do regularly and will become a part of your life. I have to profile our puppy at this stage because since we got a dog, we've had to walk every day. It's not essential that you all get a similar pet, but having something that forces you out does mean it does happen. It needs to be manageable daily, so you could do that exercise and you're not so destroyed for the next 5 days that you can't do anything else. So it needs to be at a level that's sustainable. You might think about stretches as part of your routine. You might think about fitness work, and we'd hope you'd think about strength work as well. If those are the 3 areas of exercise, other things to add to that. Accountability, so is there somebody to say, oh, have you done your routine today? Did you do it yesterday? Right, okay, well, you're on top of that. It could be somebody in your life. If you're like me, you might have something on your phone that tells you if you've not learnt Spanish today or if you've not done whatever else. So should you have something on your phone that just reminds you to do a routine? It's more fun to do it together. Is there somebody else that wants to take up the walking you've decided is going to be your fitness regime? That would be better. And just to reinforce, did I say something you enjoy and that you will keep doing? So I'm going back to the global G-Force group again, and this is just the idea that perhaps exercise is not the ideal word. For some people, the thought of exercise is sufficient to put them off it. So we should really consider physical activity as a broader group, which could be mowing the lawn. It could be something I'm doing later, walking to the train station, I can see is on the top there. It could be vacuuming, making the bed, whatever it may be. There are things that will get you fitter and keep you more active that are part of your regular routine anyway. You might need to think about finding your level. What is sustainable that you could do every day from a fitness point of view? So there's the concept of taking a few days and just keeping a measure of what you're doing. So it could be, for instance, in this example, day 1 you walk for 6 minutes, day 2 for 4 minutes, day 3 for 5 minutes. Therefore, you think, okay, on average, that was a 5-minute walk that I tolerated and I coped with. I'm going to take that to 80% such that I could do it every day, no matter how I'm feeling, which would be a 4-minute walk as your standard, safe, effective level. If that is your level 4 minutes, we then need to think about gradually increasing it. We've not published this, and I slightly joke as I call it the Salford Royal Way, but this is what we've worked on, is increase it by maybe 2 to 5% per week or 5 to 10% per fortnight. So if it was a 4-minute walk, this is why I test my maths, if it was a 4-minute walk, 2 weeks later it might be 10% more, which is 4 point something minutes, 4.8 maybe. So it's gradual. It is quite subtle, that increase. And we've got an example patient we worked with a while back in the yellow here, where they identified that progress in the kind of lilac-y colour in the middle. So the lilac told them how much more they had to do of their exercise per week. And then we tried to keep them of not doing too much more than that, the dark blue, and not doing too much less in the orange. So you're keeping it quite consistent for your body to cope with your gradual fitness gains. Whilst the leaflet is out of press, we have got the website for your physiotherapy exercise from SI UK. In addition, there are some great resources, again, looking around the world. We're going to France, and the Cochin Hospital have written this 200-page exercise booklet, which covers everything you might want to stretch living with scleroderma. And all of the images are people living with scleroderma, so it looks a bit more realistic and is a really useful resource to cover anything you might need to do. My angle with this tends to be maybe once a month you might try all of them, see if there's anything tight or stiff, but as a regular pattern you might just pick 2 or 3, which is your main targets. So this is the 5-minute video that is on the internet, and we will have a look at a bit later. If not, you can find yourself. It is on the SR UK site, and it's me talking for 2 minutes. Please just whiz through that because you've already heard enough of me talking today. But at 1:30, we start doing the exercises together, and you can see how we manage that for the hand routine. You can join along. However, we're going to move on to facial exercises at this stage. As I mentioned, impact on your eating, perhaps your visit to the dentist, your communication skills. This is a American study that looked at how it impacts on your dental health, with 28% of people living with scleroderma saying they found it really difficult to find a dentist who's prepared to treat them due to their mouth opening restrictions. And 63% would not recommend their current dentist to other scleroderma patients. So it's not a great summary of that challenge. So if you have got a dentist who can work around perhaps some restrictions to mouth opening, please keep them. So one thing we'll do when we first meet people in physiotherapy living with scleroderma is we will look at mouth opening, and we will measure it, usually in a lying position like you're at the dentist, and you can get an idea of what we consider to be normal mouth opening for males or females. Anything less than 30 millimetres, and we'd say you really do need to start this routine to get your mouth back up to a level where you can better interact with the issues discussed. And what will that look like? So we'll ask you to warm up the area with perhaps with a warm, wet flannel to get some heat pumping into the area, and then move through 3 forms of exercise. Firstly, some facial grimacing, then some oral stretches, and then rather like this world record breaking mouth opener. Yes, please don't try and exactly copy that. Pulling at the skin to get that slightly larger movement. We're going to have a go at this if this is okay. The models vary in quality on the images of the slides I have ahead of me, but if you don't mind all starting just with opening your mouth as wide as you can. Now we'd normally hold this for 10 seconds, but in the interest of time we'll do a little bit less. Same exercise, this time you're maintaining your lips over your teeth. Okay, thank you. Then you can grab a hold of your jaw and pull that down to get a bit of a stretch. Okay, pop your lips back together so you've got a tight seal, and then you're going to purse your lips from there. So it's pushing a little bit of air into the lips there to stretch them. If that's pushing a little bit of air, the next one is pushing a lot of air, maximally filling your mouth at that stage. And then one for our photographer, we're going to all make an exaggerated smile again to stretch the skin around the face there. Thank you. And then hands on the jaw, taking it one side and the other side. Next one, we're going to look at what we call the silent scream. So you're looking up towards the ceiling, opening your mouth fully. And once you've got as high as you can looking up to the ceiling with the mouth open, you then close the mouth, and you should feel the skin along your neck really tightening up. And it should be quite a pleasant stretch, that one. Thank you so much for joining in. So that was the mandated everybody join in. The next bit is entirely optional because it does slightly challenge some of our infection control procedures, because these are the oral stretches that seem to get us better results. And the idea is you're putting your thumb into your mouth and then pulling the skin to one side or the other. So you please don't need to join in at this stage. Want to take home and perhaps try in the comfort and privacy of your own home. But the idea is we're putting the thumb in and stretching to one side, stretching to the other side, and then to both sides together. The final version of this, and the thing that I think probably works best from my experience, is when we do what's called oral augmentation, which is not a term to put into your search engine, I'm afraid. But the medical concept of this is that we use something to augment the stretching on the mouth there, using some tongue depressors to open the mouth. These are the tongue depressors. And in that position, we splint open the mouth at its maximum area. And with the mouth splintered open, we need to sustain that stretch position for anywhere between 10 to 20 minutes. Yeah, it's quite a challenge. If you have xerostomia, which is a dry mouth, this is probably a bit more tolerable. If you don't have xerostomia, you'll find dribble coming down your face as you're doing this routine. And I would say my experience of teaching this to lots of people is about 50-50. They either love it, it works brilliantly for them, and they improve, or they hate it, and we never mention it again. So please do take that as is. And it takes me back to my penultimate slide saying it really is one size does not fit all. So find a routine that works for you. So I'll just finish by profiling the idea that we would think hand exercises would be useful for most people as a habit. For some people, adding in the mouth exercises if there's a tightness there. It should be auto-assisted, so you're giving that an extra push or a pull in the mouth, whatever it may be. We want you to grade your fitness levels so you're gradually getting fitter. A little bit of profile for hydrotherapy there. We do find a lot of our patients living with Raynaud's and particularly the tightness of scleroderma find good benefit from being in the warmer water than you get in a council pool, and to stretch off and work on fitness in there. It could be you can get a local fitness class you can join in with. We offer discounted access to our local gym facilities for people living with long-term conditions. Ideally, I'd hope there's a physiotherapist who might see you at least once a year to check how you're getting on, redo your measures, see what your movement looks like. And then finally, I wanted to profile that we do have an annual open day at Salford where we invite all of our patients in and again, give them updates on how things are going. So I hope that summarised the little bit of the science behind what we do from an exercise and stretch profile, but also how you might apply it. Now I'm going to look at our wonderful chair and organising team to say, have we got 2 minutes to do some finger exercises together, or should we go straight to questions?
Let's do a couple, will we?
Yeah, why don't we then? Right, I'm going to test the technology here and see if it will just play this video. Oh, yeah, thank you. And if you could scroll to minute 130, whoever's in charge there.
Scientific journals with regards to scleroderma treatment for maybe 30 or 40 years or more. The versions we're going to look at were honed in a study probably about 25 years ago.
So I'm going to interrupt myself, which is rather impolite, but I think it's tolerable. So as I say, this is on the SI UK website. We should have recorded it from the Let's Start the Exercises here, because if this does become your regular friend, you'll keep on scrolling it to just get to the action point, really. We had one of our the local volunteers join us for this. So there's a lady living with scleroderma who's doing the exercises with us on the video. And we do each of the fingers for 10 seconds. So it's for you to join in with. We'll probably not do every finger for 10 seconds this afternoon. This guy does talk a lot. Oh, here we go. Right. Yeah.
We're going to look at straightening the fingers as best as we can. As I've said, the best way to stretch is by forcing the finger with the other hand. So hopefully you've got enough hand function to do this. If not, you can ask a family member, a household member or a friend to help you. But starting with your index finger for me, if you could lift up under the pad of the index finger and try and get that finger as straight as possible. Yeah, great. And with all of these stretches, we're holding for 10 seconds. Okay, and then we'll move through to the middle finger next, same routine, lifting it up and trying to get it as straight as possible. Where are you feeling the stretch there, Una?
Just there, if you can see where it's white.
Yeah, quite distinct of the stretch under the skin there, isn't it?
Yeah.
But of course, you'll always feel the stretch at the tightest part, which is fine.
Yeah.
Okay, we'll move on to the ring finger next. And again, pushing that up straight as far as we can. And finally, the little finger, same stretch there.
We'll just do one of the flexion routine, the curling the fingers routine, I think.
Okay, so we'll do the same for the other side. So this time
the
it's the
video
left
does
hand
go
being
on.
stretched,
Sorry,
the right hand
maybe
is
we'll
grabbing
stop
hold
the
of
video there.
the
Thank
pad
you
of
very
that
much. I hope
fingertip
you've got the
and lift it
idea,
up.
and it is an option to go back to and join as much as you need until it's well embedded. So I think that completes what I wanted to talk through. Thanks very much for your attention.